Is you just want to relax your head all the way.
You're listening to the Stay Sore podcast.
All right, guys, welcome back to the Stay Sore podcast. As always, I'm your host, Skitsko, and today I have the pleasure to talk to Dr. Sara Perry. We are here in a chiropractic and, from what I understand, holistic health clinic, Inspired Chiropractics and Wellness in Lakewood, right?
Yes.
All right, I have some questions for you. I'm gonna play like the devil's advocate and gonna try to ask difficult questions that I hear from my clients, from other people about chiropractics, the practice of it. Are you willing to give me some answers?
Yeah, let's get weird.
Okay, let's get it. Chiropractors, are they real doctors?
Yeah, well, define real doctor. I mean, we go to school for 10 trimesters after receiving a bachelor's degree. So trimesters meaning 3 sort of semesters in a year round with 2-week breaks. And so yeah, that's about when you like spread it out, it would be like 5 years. It's got a lot of the same coursework as medical doctors, just without the like residency and fellowships and all that kind of stuff after. So yeah, I think, part of why we get all that training is because we need to know what is in our scope of practice and what we need to refer out for. And so like we have to learn a little bit about every part of the body, every system.
It sounds familiar to personal training because there's things as a personal trainer you can do, and then there's things you should refer to other professionals.
Yeah, I have to ask you a question on that. Can I ask a question?
Yeah, go ahead.
Okay, so do you get medical doctors referring people to you because they're not personal trainers and they feel ill-equipped to advise their patients on personal training and exercise?
Good question. How about the good ones do?
Okay.
So some doctors, unfortunately, from my experience, a doctor has like 10 to 12 minutes with the client. So you either have time to prescribe a pill or refer to someone.
Yeah.
Because unfortunately, they usually don't have time to figure out your lifestyle, your nutrition, your habits, and figure out why do you feel certain symptoms, So it's either prescribe a pill or refer to someone else. So yeah, does that answer your question?
Yeah, and I was kind of getting at me either. I don't get a ton of I do get referrals from doctors once they meet me and I know them, but I don't get a ton of referrals. Yet every doctor I've ever asked feels ill-equipped to handle back pain outside of like loaded doses of ibuprofen or a PT referral. But many don't feel comfortable with a chiropractic referral. And I'm like, but isn't it kind of out of your scope if you don't know how to treat it? That's what I have to do. You know what I mean?
Okay,
I have to tease them.
I understand. I get it. That's going to keep it interesting. But you just opened the next question. What's the difference? Let's say you have back pain, the most common situation. 90% of Americans will experience some discomfort or pain in their backs. What's the difference of going to a chiropractor versus to a physical therapist?
So physical therapy focuses a lot on the muscles, movement, retraining the body, and there's a huge rehabilitating an area. Like if your knee can't bend all the way like this and all the way like this, they get it back to that, balance the muscles, help you function. Chiropractic looks through the lens of the nervous system. So what's inhibiting the nervous system? A bunch of tight muscles and a bunch of bones that are out of place that aren't allowing your nerve to tell your muscles what to do. So if your nerve is like, hey muscle, do this. It's kind of like your nerve has a mask on. Hey muscle, do this. And it's like inhibited, So it's just a different lens with the same goal in mind. And sometimes only a chiropractic adjustment will make the change you need. And sometimes only the right amount of rehabilitative exercises and retraining of the body will get the results you need. So what if we all worked hand in hand?
Okay, so yeah, I believe in that too. If everyone does their job right, then we can help a person the best.
Yes.
So chiropractic adjustments, in your experience, there's a bunch of people that actually are afraid of chiropractors. What if they crack me wrong? What is the crack? I'm afraid of the neck being adjusted and then I will be paralyzed. Why are people afraid of chiropractors if they are? And have you had that experience?
Yeah, I get that experience a lot. One of the questions I always ask people is like, do you have any hesitation about your bones popping, clicking, cracking, whatever you want to call it? So I address that a lot. And part of it is just like a rapport with people. I like to compare it to pulling a Band-Aid off. That's something no one loves to do. They're not like, I love that feeling, but you got to do it quick and effectively, and then it's over. That's what a chiropractic adjustment is like. It's like a feeling that's kind of intense, quick, loud, different. It requires an element of vulnerability. And then you on the other side, you're like, whoo, I feel better. I have relief. I have range of motion. You feel better. But like that moment, you wouldn't want that to go slow. Like, right? So it's just quick. And I think that's why it's scary, because it's not well understood. And, but when you talk people through that, you explain like how this could benefit them and like the rush of neurochemicals they'll get that are similar to like what you get after a great workout. You're like, ooh, I felt great. What just happened? Like,
what you mentioned all those words, crack, pop, click. What is that? What most people think it's just bone rubbing against bone.
Yeah.
From what I know, it's not that. Can you explain what that actually is, that sound that we hear, or the sensation of clicking?
Sure, yeah. It's nitrogen gas bubbles is like the quick answer. Spine farts. Oh, sorry, I said it. But it's nitrogen gas bubbles. It's like you like get a sense of release. It's a release of chemicals at the same time, and it is like the actual motion of a bone being restricted and then restored back to motion. So if it's just stuck and you're trying to like, your bones are like this and you're trying to turn your head, you're like, right? And so when we pop them back into place,
so you
nice.
realign all the individual joints back to where they're supposed to be, rather where they're stuck and can't move properly, right?
Yeah, so kind of less, I would say a little less like out of place. So there's not like one perfect structure that you should have and hold all the time, like posture.
Yeah.
If I could just stay like this, it would solve none of your problems. It's about moving in and out of any position comfortably without pain and being able to freely move and function. Not have dysfunction. So it's really more about like restoring movement than this is the right place to stay, because you've got to be able to do all the things.
So it's making the joint more mobile and more range. Okay,
totally.
Got it. You manage spine farts.
Yeah.
No, I like that. I like that. Have you ever had any funny stories, or does that because that happens in personal training quite a lot. A person doing sit-ups or something, and all of a sudden, out of nowhere, there's a little bit of gas. And then as a professional, you try to either make a joke or just ignore it. So does that happen with adjustments when you crack a person and then whoops?
Yes, all the time.
Okay, so if any one of you listeners have that, don't feel embarrassed. It happens in personal training. It happens during chiropractic adjustments all the time.
Let it out. It's a sign. It's a sign of healthy function in the body, right? And the other thing with that is your nerves in your lumbar spine go to your like down your legs to the tips of your toes, but they also go to your vital organs. So they go to your intestines, your colon. They allow you when imbalance, like when your bones are out of place or not functioning and your nerves can't fire properly, it can actually back you up and make you constipated. And so if I adjust your low back, a lot of people are like, man, I always have to go to the bathroom right after this.
But that's a good sign.
It's a great
means
sign.
It works.
Yeah. It means we're restoring function. We're allowing things to flow. It's a great thing. So if a little gas comes along the way, like, I'm like, wow, what a great release.
Nice. Okay. So don't be embarrassed if that happens to you. It happens all the time.
Yep.
Is there ever any times where can a chiropractor actually hurt a person? Because people are afraid of that. Can you like snap somebody's neck and then the person is injured?
Yeah. I mean, so.
Okay, you just lost 50% of the listen. No, I'm just kidding.
All the time. No, I mean, like, so can anything hurt someone? Like, so I don't usually hurt people, but they hurt themselves a lot just by living their lives. And a workout can hurt someone.
True.
And it's not your fault.
I'd like to think no,
right?
Usually,
surgery can kill someone.
Yes.
Right? Or it can really help save someone's life. So many things, like a shot or a drug can hurt someone. Anything can hurt you. Is it likely? No. What makes it even less likely? Being responsible, doing a thorough exam, studying for 10 trimesters, the proper like position, line of drive, force, speed, analysis of the body, diagnosis.
So
like
there's a lot of practical studying when
Oh
you.
yeah.
Okay.
Yeah, so like, I'm not just like hoping your body like cracks like a glow stick the whole time, I'm like analyzing, assessing, loosening the muscles, using only the force necessary in the right direction. Like there's so much care that goes into what I do and what chiropractors in general do. And I think like chiropractors just, man, we're kind of the underdog sometimes, it's like, oh, he hurt me or she hurt me. And I'm like, did you talk to them like about it? Like, it's everything, like you can get sore, you can get hurt. It's just highly unlikely. And it's like super important to communicate about your symptoms before, during, and after your appointment.
Okay. As a client or as a doctor, communicate?
Yes, both.
Both. Okay.
100% both.
So that brings me to the next question. How do you find, or how do you differentiate between a so-so chiropractor, a good chiropractor? How do you find somebody you can trust?
Well, you start here.
Obviously.
No, I think it's such a personal thing. I think like you can like just ask important questions, like arm yourself with important questions. What matters to you? What scares you? Put it out there. Like just say it,
I like that.
Don't just like quietly sit and wait for them to get you. Like that's silly. That wouldn't work in any relationship ever. Like if you just quietly sit and wait for your wife to understand all your needs, are they suddenly met? I don't know. Usually you have to like...
That's usually my strategy. You just killed it.
Oh,
I'm kidding.
I'm going to go into counseling. But you know what I mean? So just ask important questions and get explain why you're there. One of my favorite questions is, what is your expectation of me as your potential new chiropractor? And people are like, expectations? And I'm like, yeah. Like I'd like to exceed them. And I don't know how to do that unless I ask. So
communication is number one. Okay. Would you encourage somebody to maybe say, I don't feel comfortable with this, I'm probably not going to proceed with this session or something?
Yeah, and I always say like to people, I always say, so if there's hesitation or something ends up feeling bad, I'm not here to adjust you in my favorite way for your body. I'm here to find your body's best response to what I do. Like it's about you, the patient. You are a unique individual. And so if you come to me and you're like, I was sore for 3 days after you used that massage gun, like I can't do that part anymore. I'd be like, oh, good thing I have a Santa-sized bag of tricks that I can pull from to try something else that would work for you.
The exact same thing happens in my personal training gym or any other professional place of service where you have to communicate. There's not one rule for everyone. That's why it's called personal training. That's why you're a doctor and you treat people individually. You don't track a group of people.
Well, that's why I love what we do, because we are holding on to the individual as the highest, most important part. Like I guarantee you don't say like, all right, my goal for you is like, what is your client's goal for them? But in the medical world, while we have important, impressive procedures and drugs and vaccines here to save us all, it is one vaccine for every person. It is one drug for every thyroid. It is one surgery for every heart. There's a place for that. We're working on we have to have those things for when disaster strikes.
Yeah.
But that is not what health is. That is not what is important about taking care of yourself. Like, everyone is so different. So that's where I think it can get a little...
So an individual approach is usually the best way to...
It's the only way to actually have health. And I'm super passionate about that.
I actually have to agree with that. Okay, so let's continue. Why would somebody go to a chiropractor and get cracked? Meaning, what are the benefits?
Yeah, so like instant pain relief, instant like range of motion. A lot of times people say like, oh, I didn't realize I couldn't even see behind me when I was pulling out of my driveway, and now I can.
Okay.
So you move more, you move better. You usually have like a sense of almost like energy, or just like you just feel better. Some people describe it as blood flow, returning. Some people describe it as like an increase in energy, range of motion, like ease. in the body. And so that comes with like pain relief, headache and migraine relief, low back pain, middle back pain, shoulders, elbows, hands, wrists, toes, knees, hips, head, shoulders, knees, toes, right?
So how about this? So from what I understand, chiropractors are not just cracking your spine. There's more to it. You can deal with wrists, fingers, elbows, shoulders, and all that stuff, right?
Yeah.
So there's more than just the spine?
It's funny because people will be like, my wrist hurts, can you pop it? And I'm like, I mean, there's like a bunch of little bones in there and we can play around and pop it, but probably it's the muscles above and below it that are acting on it, that are pulling on it and hurting. So it takes a unique, not all chiropractors dive into all of that maybe, but we have all learned how to treat all of that. Okay. It's just like, I really like doing muscle work too. My mom used to say, tenderize the meat first. So I like work on the muscles, loosen them up, and then boom, things move easier and stay better for longer. Okay, so besides cracking, there's other things that chiropractors do. Yeah.
Like?
So you have like your traditional like chiropractic offices that are like, you walk in, you lay face down, crack, 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 see you later, bye. Then you have...
I have actually experienced that. Not the biggest fan. It still has some benefit. Yeah. I do feel better from those cracks, but just a quick crack, like you feel like you're in a factory and you're part of, it's just next.
Well, those offices usually see the highest volume of people because it takes them hardly any time to do it. Yeah. And so it works for some people. So, hey, whatever, there's a place for that.
It's like any workout is better than no workout.
Right. But like yours is better than anybody else's.
It always is.
That's how I feel. But we're just a big fan of our individual work, So then you have your offices where they'll like use other modalities like a TENS unit or an E-stim machine that like vibrates on your back or something like that, ice, heat, and then do the adjustment. So they do a little more for you, let you sit on a rolly table or a massage chair.
I love those.
Yeah.
The rolling table that like traction or whatever it's called.
Yeah, they're nice, they're relaxing. And so that's your next kind of style of office. And then you have people who just take a little bit longer, do a lot of the muscle work themselves and combine it with massage and different things. And that's, some chiropractors like judge me for integrating massage and muscle work into what I do because they're like, the adjustment does enough. And I'm like, well, yeah, but I happen to really love the other part. So and then we do acupuncture and functional medicine and all those things too. So
yes, I have been actually to many different chiropractors, and it seems like there's individual approaches to everything. Everyone adjusts you, yes, but different ways, different approaches, different structures, and like what the procedure of 1, 2, 3. Yeah. And I happen to love the tissue work a lot when like a muscle pulls in your spine, adjusting the spine is good, but actually releasing the tight muscle then prevents it from getting out of alignment and stuff. Yeah. So I love that part.
I think if you didn't do the adjustment, it wouldn't stay better or really get better. So I think the adjustment's the most important, but whatever you add is so personal. Like that's what worked well for me, is all the muscle work. So that's what I do and love and am passionate about. Other people are like, this one adjustment to my Atlas, my C1 right up here changed my life. And that happens all the time. So they open a practice where they just adjust this bone and they still make a difference. So like getting adjusted is the most important. Everything else is such a personal thing. So like find your fit,
I always compare chiropractic adjustments to wheel alignments. Like if your wheels are not aligned in your car, you're wearing out your tires. Yeah. You burn them out and then you have to replace them sooner. So if your spine, neck, and everything else is properly aligned, then you're not beating up your joints and they can work for you longer.
Yeah.
So that's
get your chiropractic alignment. Right? And that's totally. That's what we talk about a lot.
So what do you think as a chiropractor? What do you think about people cracking their fingers, people cracking on spinning their, like twisting their spine, and then they try to yank it so it cracks? Is that good? Is that bad?
No, I mean like cracking your fingers and your neck and your back, like kind of like you asked earlier, like can it hurt you? Well, when you have no training at it, you're a lot more likely to hurt yourself. So doing that, you put yourself at risk. Are you honestly gonna like, help yourself that much? No, but I get why you're doing it. It feels good. It's chemical release. It gives you a little hint of relief, and sometimes maybe you get a really good one. So I get it. It's not going to help that much, and it's not going to hurt that much, most likely. But yeah, it's risky. I mean,
can you, like, if you keep cracking, some people just do it because they're bored, they crack their fingers.
It's
Can
kind
they
of an
have
addiction thing.
yeah,
Yeah.
but can they like build up more arthritis over the years when they get older or something from that particular habit?
Yeah, arguably, especially when you use any kind of pressure. If you're just like stretching and things pop, it's less, you're probably fine. But if you're going to be like pushing on
Forcefully?
things, you're reinforcing a bad pattern, you know?
Okay.
So yeah, maybe, arguably.
Understood. What would you recommend, just the average person? What would you recommend for spine health?
Once a month. I would recommend like moving your body in each direction every day. So if you expect your head to suddenly be able to go, what was that? But you never look that far right or left, you're going to hurt yourself when you try. And so like move your body in each direction every day, first and foremost. Second, get adjusted. Do a care plan. Like come get an exam and a treatment by a chiropractor. See how good you can get your body by doing a bunch in a row. Like what is your potential? Like what is your spine's potential? I don't even know what my spine's potential is because I haven't done a care plan in so long. I can't wait to start it in January.
There you go.
But you know, like, so get what's your best ever spine. Then from there, how few times can you get adjusted but still maintain that? And usually like my go-to is like once a month, just go get a checkup, go get an adjustment, go talk to a doctor that is concerned with you as an individual, with your function of your body, your basic like health and wellness. And like that does a lot for you.
I think no matter where you go, to a nutritionist, to a chiropractor, to a trainer, to a whoever, to a barber, you will, after 1 or 2 sessions, you will probably know if the person is after your wallet or after your benefit and health and stuff. So you will know if a person wants to get you in there for your health or just to get paid. So you will probably know.
Yep.
So last question. What do you think, or what would you say or recommend, or your experience, professional and personal, about when does a person need an adjustment and when is it better to not get an adjustment? When could it be dangerous?
Yeah. You know, so it's easy, like anyone really needs an adjustment, which is...
Are you saying that because it's true or because you're a chiropractor?
Because it's true. So like a baby just went through a birth canal and like their head is all misshapen and they're tight and they were wrapped up like this and they're in a brand new world and they could use an adjustment. It looks a lot different from how I adjust you, right? It's like really gentle and soft and stretchy and all these things. But I just saw a 2-week-old yesterday.
Sorry, but that sounds almost like scary.
Yeah, well, I mean, what I do is I like hold the baby and bounce and stretch them. And I'm like, this is how you can tell if they have good mobility in their side body. This is also a great stretch for their head. Here's how you relieve some gas and constipation. Here's how the pressure you use. And it's like, do, 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 do. You know, so it does sound scary until you like see it or know it. It's like that baby just slept. He was like,
I understand.
I love it.
I just don't know. That's why I'm saying that.
Totally.
I've never seen
that. I know. People are like, you're a baby cracker. And I'm like, ugh. They wouldn't crack if you tried. They're made of rubber, essentially. Cartilage. But, and then like little kids as they're growing and developing and young athletes, you know, really important to just make sure their body's functioning well and adjusting to the growing biomechanical demands on their body as they get older. Makes sense. Most adults, like we sit to eat, we sit to drive, we sit to work, we sit to sleep, we sit to text, we sit to sleep, what we like.
I hope you don't sit to sleep.
You know, we like are always just so tense and tight.
Forward flexion. Yeah.
And so like something that just it reinforces more movement is always great. Like anyone who has any kind of like pain, headaches, pain into the arms or legs, those kind of things are very specifically chiropractic related. And then as you get older, women who are pregnant, again, changing biomechanical needs, you know, growing, like you're carrying something in front of you, you're growing a baby, like you get that kind of sometimes pain. The pelvis has to expand and open up and relax. So there are specific chiropractic techniques just for pregnant women. And then just as you age, like things start to move less. And what restores your mobility? Chiropractic. So restoring motion regularly as you age. So really like all different kind of age groups can benefit. It's just the technique looks a little different throughout life. So I don't see a huge Medicare population, just because I think my technique doesn't necessarily like lend itself to that population maybe. But because they just need less. Like they're usually good with like an adjustment. So really anyone. But then there are times when, you know, maybe you've had a spinal fusion or a surgery. But what I always tell those patients is like, oh, did they fuse your entire spine? And they like kind of look at me like, no. And I'm like, oh, good. So you have a ton of bones left over that we can work on. And those matter too, right? Like just because L4 and 5 are fused doesn't mean that like L3, 2, 1, T12, you know, like everything else doesn't matter. Arguably it matters more because they have to do the job of L4 and 5 now too. Okay. So like even if you've had, it takes a different and a much like cared for approach, some extra imaging, those kind of things. But like even in that population, you can, like I have patients that have spinal cord injuries that still get adjusted above the level of their spinal cord injury. So, you know. So
is chiropractic more beneficial for treating or for preventing injuries?
Both.
Okay, just asking.
Yeah.
Just asking, because
it's just hard to prove that it prevents it. You know.
Yes, it's like how does health influence your? I mean, how does working out, physical activity influence your mood? It does, but it's hard to prove.
Well, and like, what have I prevented from working out with you? Like probably like heart attacks and pain and all these things. But we'll never prove it, right? I could attribute the fact that I don't have cancer yet to you and our workouts together because I know exercise is great. But like we'll never know for sure, right?
True. So I'm just trying to get more information for the listeners, just something they can think about, and maybe it's going to make their decision to go or not to go or to decide a little easier, give them more information. And thank you so much for this conversation. I got something out of it as well. Now I really want an adjustment because honestly, I didn't want to say it before, but I personally love chiropractic adjustments if they're done right. And honestly, not all the time. I just do it as prevention. I lift a lot of weights and I like to go once a month, maybe every 6 weeks, depending how I feel. Just get my alignment right so I can perform in the gym and work out better, knowing my car is driving on perfectly aligned wheels because I want to drive a long way.
Yeah.
Where can people find you if they want to have an adjustment?
Sure. You can text us at our business line. That's a super quick, easy way to like talk about an appointment. So that number is 216-801-4322. You can find us online. Just search Inspired Chiropractic and Wellness. Read our Google reviews. We get a ton of them, and every time we're like, I'm not crying, you're crying, because we love our people and they have the best things to say about us, and it like fills me up when I get them. So read those if you want to see what other people think. We're on Facebook, we're on Instagram, we're doing a 12 days of giveaways right now on Facebook. Awesome. So if you want to, you know,
I'll link
win
all that
some
stuff.
Yeah.
I'll link all that stuff, information in the description, of course.
And also just don't be afraid to reach out and say, hey, I have some questions, you know, like, can I just ask you some questions before I schedule? Yeah, that's what I'm here for sure.
Nice. All right, let's get adjusted.
Ooh, let's do it.